Now, you've learned a little bit about the potential mechanisms, but how do we learn more about which one it might be in your case? And this is why post-progression testing is so important. So what do I mean by that? Well, this is a really nice diagram here that shows you, okay, unfortunately, a patient has resistance to their targeted therapy that we start off with. Their disease grows, and sometimes it can grow in that widespread manner, like I showed you, which we call systemic progression. What test can we do now? We heard a lot about some of the tests from Dr. Marks and others in session one about what we should do and how we should test for repeat molecular testing. And we can do it on a liquid biopsy, a blood test, but also a tissue biopsy. And so I would advocate and I would discuss with your oncology team, if your disease grows on the targeted therapy, we want to learn more. We need more testing. So we need more profiling. And we can do that in both of these different ways. And again, that information can help us figure out which resistance mechanism is happening in that case. And it's going to help guide decisions for your next line of treatment. When you get your results, there's really three potential options if a patient has widespread disease progression. One is clinical trials. Please ask about clinical trials with your team. If you have a local academic center nearby, ask for a second opinion, advocate for yourself. You won't know what the options are until you ask, right? So I think clinical trials should definitely be considered in this case. Next, you want to really try to target any specific mechanisms of resistance. I showed you on-target mechanisms of resistance, off-target mechanisms of resistance. Those can potentially still offer a targeted way to overcome that resistance. So really think about that as well. And then if you can't get onto clinical trial, we can't find a very specific mechanism of resistance to continue a different type of targeted therapy or add in a different type of targeted therapy, then we have standard of care options. For standard care options, chemotherapy is really our staple. It's our backbone, and we've talked a little bit about chemotherapy already. So when do you generally add chemotherapy if you have progression of disease on targeted therapy? Well, generally, what I would say is for patients who are having very rapid, very symptomatic disease burden and widespread progression, you want to consider adding chemo. Also, in cases of small cell transformation, that highly aggressive type of disease, unfortunately, our options right now are quite limited. And so we really need to rely on chemotherapy, which can work quickly and work well for patients. So chemotherapy is recommended if small cell transformation occurs. There is controversy, and we've already touched on it a bit, about whether you should continue your targeted therapy at the time of progression. And so I would discuss the pros and cons of that with your oncology team. To kind of round out this discussion and talk about what may be coming in the future, something that we're really excited about is antibody-drug conjugates, or ADCs. And this is a new treatment approach, and we'll probably hear more about this later today. But what are ADCs? Well, ADCs are this new class of drugs, and they deliver chemotherapy in a really smart way. So they deliver it directly to the cancer cell. So this is a mean, angry cancer cell that I found. And this is an antibody-drug conjugate. It's the blue, green, and then this red with a Death Star on it. But essentially, the antibody-drug conjugate will have an antibody part that directly attaches to the cancer cell. And then it'll have this linker that's holding onto a very high chemotherapeutic cytotoxic payload. And it'll drop it into the cancer cell. And sometimes it can even go outside of just that specific cancer cell and kill some nearby cancer cells as well, which we call a bystander effect. So this is a smart way to deliver a very high cytotoxic payload to a cancer cell, and it offers precise targeting, cytotoxic effects, and minimizes off-target toxicity. The reason I'm talking about it is because there is a growing interest in looking at this class of drugs for patients who have non-small cell lung cancer, have an actionable alteration like we've talked about today, and unfortunately their disease is growing. And so look here, you can see some potential drugs that are already approved or already being studied in clinical trials. And there's different types of antibody-drug conjugates. There's ones where we really need to know if the tumor is expressing a certain pathway or protein, so we can link onto it and cause that effect, that cytotoxic effect. And then there's some where we don't necessarily need to know how much of that protein is being expressed on the cancer cells, and we can still use it. And so these are potential off-the-shelf, ready-to-go drugs that we can reach for in the future or on clinical trial to help overcome that resistance that some patients may experience on targeted therapy. So stay tuned. We'll talk more about this, I'm sure, this session. So my summary and key takeaways: 1, resistance to targeted therapy is common and it's complex. 2, disease progression type and the extent of that disease progression really does matter. 3, and this is essential, please discuss it with your team. Post-progression testing is key. So that liquid biopsy, that tissue biopsy, advocate for yourself, talk about the pros and cons of that. Fourth, clinical trials should absolutely be considered. If your center where you're being treated does not offer clinical trials, please ask your oncologist, hey, I'm interested in a clinical trial. Is there a center that's nearby that you might recommend? Sometimes they're the best source to offer that referral. And then finally, there is hope. There's hope for new therapies like ADCs, like new targeted therapies or TKIs that are emerging. Finally, I'll end with this. Patient support groups are so important. So groups like Cancer Grace are so meaningful. They offer an opportunity to partnership, to empower and to educate our patients. This is a list of all different biomarker-specific groups as well that you can inform yourselves about, that you can get involved with and communicate and connect with patients who are in a similar situation as you. Thank you again for the opportunity, and I really appreciate it.